Hello everyone. This session will be about anatomy of the small intestine. By the end of this session, you will be able to describe parts of the small intestine and describe the parts of and relation of the jejunum, and you will be able to describe the anatomical features of jejunum and ileum and describe blood supply, nerve supply of the small intestine. The small intestine is consists of three parts. We have duodenum, then we have jejunum, and we have ileum. It is a primary site of absorption and extends from pylorus of the stomach to the ileocecal junction. You can see here, this is a jejunum, and jejunum into the upper left and ileum into the lower right, and ileocecal junction. Jejunum have four parts. Duodenum, the site of the last stage of digestion, and it is 25 centimeter in long, has four parts. We have the first part, second part, and third part, and the fourth part. It begins from the stomach and continue with the jejunum. Jejunum is derived from the foregut and midgut. For that reason, it took its blood supply from two parts. The shortest part of the small intestine and is contained with a C-shaped structure around the head of the pancreas. It is completely retroperitoneal except for the first 2 centimeters of duodenum, of the first part. Here it's very clear is the first part of the duodenum in the black, and then the second part is the first part is the superior part, descending part, second part, horizontal part, third part, and the fourth part is the ascending part. As I said, it's divided into the four parts. We have the superior part or the first part, we have the second part or descending part, and we have the horizontal part or the third part, and ascending part or fourth part. It is very clear. You can see here in this picture on to the right of the screen. It is C-shaped and it is coiled in the head of the pancreas in between the fourth part. You have the first part, descending, horizontal, and ascending part. The total length of the duodenum is 10 inch and 25 centimeter long. The superior part or the first part at about 2 inch and slides anterolateral to the body of the first vertebrae, L1 to the L1. Descending part, it's about 3 inch descending along the right side from L1 to L3 vertebrae. In the posterior medial wall, it is received the common bile duct and main pancreatic duct at the hepatoduodenal ampulla or ampulla of Vata, which open into inside to the duodenal wall into the area called major duodenal papillae. It is halfway along the second part. Also, there is an accessory 2 centimeter approximal to the small opening of the there is accessory pancreatic duct open into the minor duodenal papillae. Into the posterior medial wall. Remember this posterior medial wall opening of the common bile duct and main pancreatic duct into the ampulla of Vater or hepatopancreatic ampulla open into major duodenal papillae. As you can see here in very nice picture, and this is pancreatic duct, main pancreatic duct join the common bile duct form what's called hepatopancreatic ampulla or ampulla of Vater, and open into inside is a major duodenal papillae, and above it is a minor pancreatic duct open into the minor duodenal papillae. This here is a major duodenal papillae, and major duodenal papillae and minor duodenal papillae. This is the lumen of the duodenum. The horizontal part is 4 inch and cross around the L3 vertebrae. Ascending part is 1 inch, begin at the left of the L3 vertebrae and arise superiorly as far as superior border of the L2 vertebrae. Duodenojejunal flexure. This is the supporting part of the small intestine. Duodenojejunal junction or flexure is supported by a ligament called suspensory muscle or suspensory ligament, or ligament of Treats, the thin band of connective tissue and smooth muscle that descend from the right crest of the diaphragm that join the small intestine to the posterior abdominal wall. Let us take this part and talk about the relation of the duodenal part. In the first part, or the superior part, we have anteriorly the peritoneum, gallbladder, and caudate lobe of the liver. Posteriorly, we have bile duct, gastroduodenal artery, hepatic portal vein, and inferior vena cava. And medially to the first part, we have the pylorus of the stomach. And superiorly, we have the neck of the gallbladder. Inferiorly, we have the neck of the pancreas. This is the relation of the first part. The second part, duodenum, we have anteriorly to we have transverse colon and transverse mesocolon and coils of the jejunum and ileum of the small intestine. And posteriorly we have hilum of the right kidney, right renal vessels, right ureter, and right psoas major. And medially we have head of the pancreas, pancreatic duct, and bile duct. Superior to the second part of the duodenum, we have the superior part of the duodenum itself, and inferiorly we have the inferior part of the duodenum. The third part of the duodenum, anteriorly we have anteriorly we have superior mesenteric artery, superior mesenteric vein, and coil of the small intestine or coil of jejunum and ileum. And posteriorly we have the right psoas major, inferior vena cava, aorta, and right ureter. There is no immediate relation to the third part. Superior we have the head and uncinate process of the pancreas and superior mesenteric vessels. Inferiorly we have also the coils of jejunum and ileum. The fourth part, anteriorly the beginning of the root of the mesenteric and coils of the jejunum, and posteriorly we have the left psoas major, left margin of the aorta. Medially we have superior mesenteric artery and vein and uncinate process of the pancreas. Superiorly we have body of the pancreas, and inferiorly we have coil of jejunum. That's all about the relation of the duodenum. You have to memorize very carefully and very well. Mucous membrane of the jejunum is like other most small intestine. It is contained with what you call plica circularis. It's a circular muscle mucosal fold. As you can see here, this is a coiled or fold is called plica circularis, as like other part of the small intestine. Blood supply of the duodenum is supplied by the branches that come from the foregut and midgut. We have the superior and inferior pancreatic duodenal artery. Superior and inferior pancreatic duodenal arteries. A superior pancreatic duodenal artery is come from the foregut, that's part of the branch of the celiac, and the inferior pancreatic duodenal artery that come from the midgut branch of superior mesenteric artery. Venous drain to the tributaries of the superior and mesenteric and portal veins. Lymphatic drain of duodenum into the accompanied to the superior and inferior pancreatic duodenal vessels to the celiac and superior mesenteric nodes. Jejunum and ileum are completely intraperitoneal organs and is about 6 to 7 meter long. 6 to 7 meter long jejunum and ileum. Jejunum, the second part of the small intestine, begin at the duodenojejunal flexure, constituting approximately the first 2/5, and the most of it lies at the upper garden of the infracolic compartments. infracolic compartment that inferior to the transverse colon. Ileum at the third part of the small intestine and at the ileocolic junction, approximately the 3/5. The most of the ileum lies in the right lower quadrant. The terminal ileum usually lies in the pelvis. Duodenum, the site of the last stage of digestion, and it is 25 centimeter in long, has four parts. We have the first part, second part, and third part, and the fourth part. It begins from the stomach and continue with the jejunum. Jejunum and ileal branch arise from superior mesenteric arteries. This is the blood supply to the jejunum and ileum mainly completely come from the branch arterial supply of the midgut that come from the mesenteric artery, superior mesenteric artery. It comes through the jejunal and ileal branch arise from superior mesenteric artery, and ileum also supply some part by ileocolic artery. Veins of all are corresponding to the arteries and drain to superior mesenteric vein. Lymphatic drain, jejunal and ileal lymph node drain to superior mesenteric lymph node. Here it is very clear. You can see the foregut branches and midgut branches. You have the celiac trunk, the main trunk from it to gastroduodenal artery. Gastroduodenal artery give us superior pancreatoduodenal artery which supply the duodenum. And also we have the branch of superior mesenteric artery which contain the ileal and jejunal branches, and also we have the ileal branch and ileocolic arteries that supply part of the ileum. This is about the blood supply of jejunum and ileum. Here it is like a comparison between the jejunum and ileum wall. That to the left of the screen is A is jejunum and B is ileum. We have the mesentery. Into mesentery we have basa recta inside, and we have then mucosa. Into the mucosa, some mucosa we have pyrus patches mainly found into the ileum, and as in the duodenum we have the circular mucosal fold inside, is called plica circularis, and we have also some mucosal arterial plexus, and we have inner circular muscle and outer longitudinal muscle, and most outside layer is the serosa. Innervation to the small intestine into the parasympathetic by vagal supply, and sympathetic supplied from the lateral horns of spinal segment of T9 and T10. Here the difference between the jejunum and ileum wall. In the color, the jejunum is a deeper red. This is in the live human being. When you see, and to differentiate between the jejunum and ileum, appearance and color of jejunum is a deeper red and ileum is a paler pink. The caliber or the lumen of the jejunum, it's thick, more thicker, 2 to 4 centimeter, and ileum is a 2 to 3 centimeter. The wall is thick and heavy in the jejunum and thin and lighter in the ileum. The vascularity, it is greater in the jejunum and less in ileum. The vasa recta, the artery that come into the mesentery, we have long vasa recta in jejunum and short vasa recta in ileum. And the arterial arcades, that the windows you have seen, this is a few and large loops into the jejunum, and many and short arterial arcades into the ileum. We found less fat in the mesentery of the jejunum and more fat in the mesentery of ileum, and the circular fold of the mucosa inside the plica circularis is large and tall and closely packaged into the jejunum, and low and spray absent in the distal part of the ileum. The lymphoid nodules are found in the submucosa. You have memorized this. The pyrus patches is few in jejunum and many of them in the ileum. It's very informative. supposed to keep this. As you can see here, this is a comparison to proximal jejunum, ileum, terminal ileum, and this is the arterial arcades down there, the windows. It is few in the jejunum and many into the ileum. So the arterial arcades and windows are few in jejunum and many into the ileum, and the arteries that arising from the arcades is called vasa recta. So we have long vasa recta into the jejunum and short vasa recta into the ileum. It is very clear, you can see here a lot of arterial arcades and short vasa recta into the ileum. Here also very clear, thick wall of the jejunum, thin wall of the ileum, pyrus patches, many into the ileum wall and few into the jejunal wall. Plica circularis and very clear in jejunum and maybe absent into the ileum, and arterial arcades that come directly from the superior mesenteric artery and then arise from it vasa recta. We have short vasa recta, a lot of arterial arcades into the ileum, and few arterial arcades and long vasa recta into the jejunum, few fats into mesentery of the jejunum, and more fat mesentery of the ileum. That's all about the anatomy of the small intestine. I hope it's very clear. Thank you very much.